Okay, secondary hypertension. The most common cause of this in adults less than 40 years old is actually thyroid function, fibromuscular dysplasia, and renal parenchymal disease. For ages 40 to 64 years old, you can have hyperaldosteronism, thyroid dysfunction again, or obstructive sleep apnea. Patients over or equal to 65 years old typically have secondary hypertension because of renal artery stenosis. When it comes to children and adolescents less than 18 years old, you want to think about renal parenchymal disease or even coarctation of the aorta. What I mentioned earlier, especially in women less than 40 years old, when you suspect some sort of secondary hypertension, you have to assess for renal artery stenosis because of fibromuscular dysplasia. As a short recap, fibromuscular dysplasia is a disease that's characterized by a stenosis of a small or even medium-sized arteries, and eventually you have proliferation of the connective tissue and muscular fibers within the arterial walls. Typically, like I mentioned earlier, young and middle-aged women are affected by FMD, and it can not only just involve the renal areas, but it can also involve the internal carotid and also the vertebral arteries. Let's briefly talk about a few of the other causes of secondary hypertension. Let's start with primary hyperparathyroidism. These patients will present with high calcium levels. They may have muscle weakness, kidney stones, and even neuropsychiatric problems such as depression or poor sleep. The pathophysiology that occurs here is you have extra parathyroid hormone. This causes hypercalcemia and eventually increased renal calcium absorption and GI calcium absorption. It affects the bone because you have bone resorption. Besides the symptoms I mentioned earlier, it can result in abdominal pain, constipation, polyuria, and even polydipsia. And majority, over 80% of these cases are due to a parathyroid adenoma. Going full circle, this is also commonly associated with hypertension. The proposed pathology and mechanism involves a renin secretion system, causing sympathetic hyperresponsiveness and also peripheral artery vasoconstriction. Prolonged manifestations of having hyperparathyroidism can cause left ventricular hypertrophy, arrhythmias, vascular, and valvular calcifications. After you treat the hyperparathyroidism, then you'll have normalization of blood pressure. Treatment is typically surgical, especially for symptomatic patients, and this will involve a parathyroidectomy or even a total parathyroidectomy, especially if all 4 glands are involved. Cinacalcet is a pharmacotherapy that is used by modulating the calcium sensitivity receptor in the parathyroid glands. What happens is you have increased sensitivity of the receptor and it inhibits PTH release. Like I mentioned earlier, there are a myriad of causes for secondary hypertension, and just to name a few, renal parenchymal disease, renal vascular disease, primary hyperaldosteronism, OSA or obstructive sleep apnea, pheochromocytoma, Cushing syndrome, thyroid disease, primary hyperparathyroidism like we covered in this video, and coarctation of the aorta.